Welcome to another episode of Med Madness, your go-to podcast for all things medical. In today's episode, we're diving into a crucial topic that every medical student needs to understand: patient autonomy in HIV diagnosis disclosure, especially in children with perinatally acquired HIV infection. Why is this important? With advances in antiretroviral therapies, these children are living longer into adulthood. This longevity brings new challenges for their caregivers, particularly around when and how to disclose the diagnosis to the child. Understanding these dynamics is essential for providing compassionate and effective care. In this episode, we'll cover common concerns caregivers face regarding diagnosis disclosure, the importance of disclosure by adolescents, the collaborative process of disclosure between families and physicians, the potential risks of delaying disclosure, and strategies for effective communication. Let's get started. Next, let's discuss common concerns caregivers face regarding diagnosis disclosure. Caregivers often face significant dilemmas about when and how to disclose an HIV diagnosis to a child. Many opt to avoid this conversation to preserve a sense of normalcy in the child's life. Concerns about how the disclosure might change family dynamics and the potential for parental HIV statuses to become public are also common. Adolescence is a critical period marked by increasing autonomy and the exploration of sexuality. Disclosing an HIV diagnosis by this stage is vital for several reasons. It helps build trust between the patient and their caregivers. Knowing their diagnosis early can lead to better adherence to medication regimens. It reduces the risk of inadvertent transmission of the virus to others. The process of disclosure is complex and needs to be handled with care. Physicians must respect the concerns of parents and guardians, giving them time to prepare. However, it is crucial for physicians to encourage families to develop a plan and timeline for disclosure. This approach should be collaborative, ensuring the family does not feel burdened with the responsibility of disclosure alone. Delaying disclosure can have significant negative impacts. The child may become upset and experience negative psychosocial effects upon learning their diagnosis later. The risk of the child unknowingly transmitting HIV to others increases. While it is important to recognize the valid concerns of caregivers, focusing solely on the downsides of delaying disclosure can instill distrust. A balanced approach that emphasizes collaboration and open communication is essential. Partial disclosure might be an option if the caregiver is against full disclosure, but it requires thorough discussion and agreement. Consider a case where a 12-year-old child with perinatally acquired HIV was not informed of their diagnosis. The parents were concerned about maintaining a normal childhood experience. However, as the child entered adolescence, they began experiencing health issues and inconsistencies in medication adherence. The family, with the help of their physician, developed a plan to disclose the diagnosis. This collaborative approach, which respected the family's concerns and provided the necessary support, resulted in the child understanding their condition, improving medication adherence, and taking steps to prevent transmission to others. This case highlights the importance of timely and well-supported disclosure. To summarize, timely disclosure of an HIV diagnosis to children with perinatally acquired HIV is essential for fostering autonomy, increasing medication adherence, and preventing transmission. This process should be collaborative, involving both the family and the physician to ensure it is handled with care and respect. Remember, engaging with our pre- and post-podcast quizzes and Anki flashcards can greatly enhance your understanding and retention of this topic. Thank you for tuning in to Med Madness, and we hope this episode has provided valuable insights into the importance of patient autonomy in HIV diagnosis disclosure. Until next time, stay curious and keep learning.